You're listening to the PT Pinecast, where smart people in healthcare come to make noise. Here's your host, Jimmy McKay.
Thanks, voiceover guy. David Harris, thanks for joining us here live at Graham Sessions.
Great to be here.
First question, where are you from?
I am from Chattanooga, Tennessee.
Awesome. And real quick, superhero backstory. What do you do? What's your role in this very vast profession?
I am currently the CEO of Pro PT out in Salem, California.
Awesome. And then Pro PT is what? Like, paint me a picture.
Pro PT is a private practice. We have about 20 clinics in the Central Valley and looking to expand and grow over the next couple of years.
Come a little closer. There we go.
All right.
All right. So we're live streaming here. We're at Graham Sessions. Super secret conference.
Absolutely.
This is like we're at the top of Avengers Tower here. So we're not supposed to talk about who said what, but we can talk about ideas. But someone from your background, what are you excited to talk about? What still freaks you out? What are you hoping to hear? We're just getting started, so we've only heard a couple different things, so I can't really ask you what have you heard altogether, but what are you looking forward to? What are you afraid of here?
You know, really looking forward to networking with this group of individuals, looking at physical therapy and where we go in the future, how we can make an impact. We've known I've been in this profession for 26 and a half years.
Good for you.
We've known so much of what we can do, and now it's starting to come to fruition. We're starting to actually realize how impactful physical therapy can be in the medical community.
What's getting in our way? You've been here for 26 years. You got to at least seen the speed bumps. Like, where are we? We can't say it's payment. You can't do that. You can't say they. What's a we thing? Where are we getting in our way?
We are getting in our way by making excuses.
Good. Right? I like that. Good. Own it.
I think we have to get out of our own way. We have to embrace our role in the healthcare spectrum, and we have to actually step up to the front instead of lying in the back and just really letting people run over us.
Okay. What's something that is completely outside of what you do in your everyday that you saw on the agenda that you're saying, ooh, I hadn't thought about that? Is there anything you're looking forward to digging into?
You know, I think I'm looking forward into digging into more of this primary care philosophy and really how we can become that practitioner of MSK, which we already are. We just have to realize our own potential. Yeah.
We're not supposed to say who said what from in the room, but I can say it if I said it. I said, this sounds great, guys. There's an 83-word definition for primary care physical therapy. And I know that's an internal definition to our profession. And I said, this is awesome. I'm not questioning the research. I'm not questioning the policy. There was just a big policy win in Utah. No notes, except if we don't message it, the public. I made everybody look outside the room, look outside the building at downtown Alexandria, Virginia. I go, if we can't explain it simply, clearly, consistently, primary care doesn't mean anything. You got to be able to make sure make it make sense to them, not just us.
Yeah. So I think you said it very, very well. How do we make it simple? What is primary care? What is MSK?
Yeah.
How do we actually take someone from not functioning at their highest level to functioning at their highest level?
I'll say it right now, the practice, the organization, the ones that can do it clearly and consistently and concisely will win. And I don't even know what win means, but they're going to have more opportunities for success. I'll put it that way.
Yeah, you know, I think win means how do we not only open up access, opening access is one part of it. How do we provide the access?
There you go.
How do we actually bring that to
the
public? You know, I think I read a paper here a while back that said we're seeing 10 to 12% of the population of the United States that actually need physical therapy.
We're arguing over 10%.
10%.
Instead of trying to reach 90.
That's right.
Right.
So I think we have to get a clear, concise, simplistic message out to the public, and we have to keep re-emphasizing that. You know, it is, yes, we have to talk to our legislators. Yes, we have to talk to the public. But ultimately, we have to provide that great quality care. We have to prove ourselves day in and day out that we are the best of the best. We have the skill. We have the knowledge. Let's go get it. Let's get it out there.
Do not disagree. If you were to been, is this your first time at Graham Sessions? You've done second. All right. When was the last time?
2 years ago.
Okay. You've been in this profession 26 years. Let's pretend that you were at Graham Sessions 15 years ago. What are a couple of wins we have put on the board in the last 15, 26 years in your career? Things that let's paint a picture for people who are entering the profession now or in the next couple of years. What are some victories we've had? Let's show them how far we've come, not saying we don't have far to go.
I think one of the biggest in my career has been, becoming a doctoring profession.
Sure.
Right. Improving our knowledge base, our research base, understanding what we do and why we do it in a better way. But I think the other one would be direct access, which is truly what we talked about this morning, primary care.
Yeah.
Really getting the ability to see a patient without having to go through 2, 3, 4 different avenues.
Yeah, the door is open.
Yes.
We got to make sure people understand why they want to walk through our door, our specific clinic or our profession's door. Why are they doing that? If you fail to do that, you confuse people. The phrase is confused people don't. Confused people never show up for the first time. Confused people don't come back. Confused people don't insert whatever it is you want them to do there. They just don't. What's on the horizon? What are you still confused at? I've heard some other people say, well, this AI thing's a thing, and I'm looking at everybody else to see where it is and how they're going to play with it. But what's on your dry erase board now that you're still solving practice-wise?
Yeah, I think technology has come so far in a very short period of time. It's getting our own, what I said earlier, getting out of our own way.
Big time. Really
embracing the idea that technology can help us treat patients better, more effectively, more efficiently. We also have to simplify that message to our own teams.
All the time.
How many people are just terrified of AI helping them with their documentation? Yet on the other side, we're like, man, documentation's killing us,
right.
Burnout, all this stuff. This is one of the things that can help us become so much more effective in what we do on a day-to-day basis, which will bring more people into our practices and allow them to receive the care that they need.
How are you adopting that? Because again, even finding a technological solution is step one, then adopting it. What are some of the things that you're like, yes, not only is this nice to have, this is need to have. So what are the things that you're actually putting into play where you work?
Right now we're putting in Scribe.
Got to.
And I think it is a very effective tool. But the most important thing is, how do we actually develop the plan and the rollout?
Yeah.
A poor rollout can just really mess up everything.
Blow everything. You don't get 2 bites of the apple with the rollout. You don't.
You really don't. And so I think we have to really work with our vendors that are helping us with these new products, make sure that we have all of the answers that we can going in.
Yeah.
And we have to really kind of have, I think John Maxwell says it very well, we have to have the meetings before the meetings. Right? We have to really get buy-in and engagement from that small group in order to kind of bring it out to the larger group. How many
clinicians? Like, what's your...
we have about 120 clinicians.
Good for you, man.
And we're piloting this program right now with 15.
Wow. See, that's smart.
Yeah.
Some people listening might be like, well, then the answer, if it's good, roll it out. Why are you doing it small before big?
You never go big before you try small, right? I think it's extremely important that we make sure that we work out any of the unanswered questions before we roll it out to the masses.
Correct. And if you find a little bit of failure in that system, now you can adjust before you go company-wide. Will you go small group everybody, or will it be smaller, a little bigger, a little bigger, a little bigger?
Yeah, a little bigger, a little bigger.
Okay.
Yeah.
What are some of the things you're looking for in terms of feedback? And my follow-up is, how did you pick those first 15? Were you looking for early adopters? Were you looking for people who were crusty, thinking, hey, if I can flip this person who's a laggard, man, this will be easy. So how'd you pick the 15, and what are you looking at? What are your sort of KPIs for a small rollout?
Yeah, you're looking for a little bit of both. I want my early adopters, and then I want my naysayers, so to speak. Because if you can prove it to both groups, then they're preaching to the masses.
Yeah, you're most likely you're going to get those tech forward leaning people going, yeah. But if you can prove it to, I call them the crusty laggards, if you can prove it to them or get them championing or saying, you know what, I went in thinking this was going to be terrible and it's not that bad. What are the things you're measuring? Are you measuring documentation time 6 months ago versus now? Are you measuring quality, speed? What are the different things you look for?
A little bit of both. One, quality of documentation is very important.
Sure.
Right? If you can't tell the story, then it's kind of worthless. So what we want to see is the documentation accurate? So when that therapist reads over that scribe, is it accurate? Does it pick up everything that they need? And then the other side is, how effective does this, or how does this help them become more efficient? Can they do an evaluation now Can they walk in the door in that room, do the evaluation, and then walk out and the evaluation's done? So they're not at home
Right.
for an hour and a half typing notes at night.
Right.
And then the other side is, can that help them improve their efficiency throughout the day
Yep.
with their patient care? Can they spend more quality time with that patient?
Yep. Looking forward, not back. If people want to get in touch with you, what's the website for the practice right now?
propt.com. And they can get in touch with me at davidharris@propt.org.
And you're on the LinkedIn's, as we call it these days. You're on the LinkedIn.
Sorry, yes, I'm on LinkedIn.
All right. We have a tradition on the show, live from Graham Sessions here at APTA headquarters.
This is the parting shot. One last mic drop moment. No pressure, just your legacy on the line.
No pressure there, just your legacy. So
No
parting shot is just, hey, just one idea, one concept. Is there something you repeat to your team, your staff, anything that you're like, don't forget this? What's your parting shot?
Yeah, it's twofold. All right. First is be the example. And
Good.
second is how far can you see? All right. What can you see in front of you? What can you see in front of this profession? And quite honestly, how can we be a part of something that is so much bigger than us?
Yeah, I love that. David, appreciate you coming to this, being part of this. It's not just the people on stage, it's the people in the audience. And I got news. If you're not at Graham Sessions, you're still in the audience,
Yes.
right? We want these ideas to leave this building here in Alexandria and spread to the rest of our profession. Thanks for a little insight. This is the first time we're doing this. I usually live stream from my living room. So why not live stream from the top of APTA headquarters?
That's right.
Appreciate it. Thanks, man.
That's it for this one, but we're just getting warmed up. Smash follow, send it to a friend, or crank up the next episode. Want to go deeper? Hit us at ptpintcast.com. Or find us on YouTube and socials at PT Pintcast. And legally, none of this was advice. It's for entertainment purposes only. See, Keith, we read the script. Happy now?